We are teaching today on sexually transmissible infections, what other books refer to as sexually transmitted diseases. Well, the area or the angle we are going to be looking at is, what are they? Sexually transmissible infections. What does it mean? What are the possible causes of sexually transmissible infections? What are the signs and symptoms? Do you know the signs, the symptoms that will make you think or suspect a sexually transmissible infection? Sometimes this word sexually transmissible infection makes some people dissociate themselves from the infections relating to the reproductive system of man. I mean, people of reproductive age. Sexually active men and women, whether married or single. You know, I would like that you take particular attention, pay particular attention to this video, because you will understand the signs and symptoms of sexually transmissible infection. Don't tell me you have not had sexual intercourse. Then just consider that there could be some signs of infection involving the reproductive system, either in the man or in the woman. Now, sexually transmissible infection, just like we call it, infections that you get them, okay, you contract them, all right, through sexual intercourse, okay? You get it from one person to the other through sexual intercourse. You can get it from a man to a woman, or from a woman to a man in sexual relationship, sexual behaviors, sexual acts. This may not only include vaginal sex where penis goes into vagina. It may have to do with kissing. It may have to do with cunnilingus, mouth to sexual organ is what we refer to as cunnilingus. Some people like sucking, okay, genitals of their loved ones. Yeah, you can still get an infection. Even if you ended at that level and did not have sexual intercourse, you could contract a disease where necessary. It is a possibility. Okay, it could be through the anus. Some people get involved in not only oral sex, they get involved in the anus, which are deviant acts. They are already very abnormal approaches. But man, the human nature being what it is, they can do and undo. However, these have causes. What are the causes of diseases or infections of the reproductive system in the female and in the man? I want us to look at it in relation to the microbes that cause the disease, the microorganisms that cause disease in the reproductive system, especially sexually transmissible infections. 1, bacteria. 2, fungi. 3, viruses. Protozoa. And including what? Now, it is important that I give you some examples of infections caused by bacteria. You see people commonly call syphilis, chlamydia, okay, gonorrhea. All these and more are caused by bacteria. And then when we go to fungi, you can get conditions like candidiasis, okay, which are caused by fungi and others. When they now talk about viruses, the kind of sexually transmissible infections caused by viruses. They will include HIV, okay, like we all know, hepatitis B virus, okay, human papilloma virus, this virus that is responsible for causing cervical cancer in ladies, and more, like herpes, okay, like the herpes simplex virus and more. They also are responsible for causing infections in the reproductive system, both in a man and in the woman. Now, let us look at the signs and symptoms. How will you know that you are having an infection? What will prompt you to move to see your doctor? I want to be very stern on this presentation because sometimes you are sick and you don't know that you are sick. Especially problems involving the reproductive system. The system that a lot of people believe that it is private. Somebody say something that's happening in my private part, it's not easy to voice it. Yes, it is true. It is very difficult to find a lady or even a man approach a hospital, go to hospital because of a problem involving the reproductive system. It takes them time to take the decision to go to hospital. That is why when you reach the hospital, even health personnel, they take your issue very serious. Remember, certain signs will indicate that you are having an infection in the reproductive system, in your genital organs. 1, an unusual vaginal discharge. An unusual urethral discharge, like from the penis in the man or from the vagina in the woman. You notice that the kind of discharge is not usual. This is not how it has been. Then it already gives a question mark because it might be more than enough what it used to be. The color might change. It might be yellowish, dirty, telling you that something is wrong. This is not the normal discharge that I used to have from my vagina. But for the man who doesn't even normally have discharge from the penis, he may notice discharge that may come out and even stick to your pants, stick to your dress, and then you find some men struggle. Once you notice that there's a discharge coming out from your penis, it's a sign of a problem. My dear brother, go and consult your doctor. Go to the hospital, even the nearest health facility. If the people there are not competent enough to handle your issue, they will refer you to somewhere that they will handle better. Now, another sign is pain. Pain on urination. You want to urinate, and while the urine is passing, you feel pain through your urethra, either the woman or the man. Please, go and consult. That is a sign of a problem. Pelvic pain. This one is that one that people commonly call underbelly pain. Lower abdominal pain. You just notice that deep under your abdomen, there is pain, sometimes even more to one side, to the right or to the left. As far as it is pain deep under your abdomen, it is an indication that there is problem within the reproductive system. Okay, you may have rashes. It may be one. It may just be few, but they will be troublesome. It may be paining, may be itching. This is another sign. Itches on your vulva like a lady or your genital parts, even to the anus. Even to the man, you may notice itches around your genital organs, around your pubic area, around even on your penis. You may notice rash that is itchy. These are signs that there is a problem there. Lumps. You may feel that there is a lump inside. You may even palpate a mass, lower abdomen, or somewhere around your genitals. It may be groups indicating presence of a problem there. An unusual vaginal bleeding. You may notice blood come out from your vagina. You may even notice blood coming out from your penis, like the man. As far as you notice blood, even as a lady, if you want to change your pants, you notice that there's blood, and you know that this is not usual. Your menses maybe just passed about a week ago, And where is blood again coming from? What could be this? Please go consult. Human beings have a tendency of waiting to say that, let me see how it will look like by tomorrow. Let me see how this sign will look like by next week. And this is how signs and symptoms of a problem start signaling, and you stay back and give time for complications to set in. Sometime before you go to hospital, it becomes already late. Remember some of the complications of the diseases or infections of the reproductive system. Some of the complications are infertility. Is there anybody who would like to be infertile? No. This is one reason why some people wait until they get married. They start looking for pregnancy and it's not forthcoming, and they start moving from one hospital to the other, from one doctor to the other, and they start discovering problems that have gone as far as blocking the tubes, like the fallopian tube blockage. You cannot just block like that. Something must have been signaling sometime and you ignored. You didn't take it serious. It was not well managed. You might have lost the pregnancy, like spontaneous abortion. You carried pregnancy 1 month, 2 months, and then you started feeling pain and then bleeding, and it came out. Some people have this and they stay in the house and say that, well, they think came out. They believe it come out. What? Did you go to hospital? And some would tell me that it happened like that. They waited for some few days and the bleeding stopped, so they did not go to any hospital. Do you know if infections set in? Can you imagine the complication that may be happening in your womb, right to your fallopian tubes? My dear sisters, if you dare get pregnant and something happen and they notice that you are bleeding, rush to the hospital. If it is coming out in lumps, even if you feel that you have lost the pregnancy, please rush to the hospital. These are really signs of problem. If they don't manage that situation well, it may be very difficult to get a pregnancy next time. So itches around the genitals. This is the reason why I was teaching us the other day about the structures of the reproductive system. I said that in the woman, the external is called the vulva, and that vulva has 9 structures only outside. If these are structures like the mons veneris, the labia majora, the labia minora, the prepuce, the clitoris, the urethral orifice, the vaginal orifice, the fourchette, the perineum, these are 9. So when you come to hospital, my dear sister, some people go to hospital, they cannot express what is happening to them. And a lot of ladies like to tell doctors that my last the itch. What do you mean by last? What do you really mean by last? Which last are we talking of? Because if last refers to the genital organs, then which one is last? Because only outside they have named 9. If 9 lasts, or what outside like this, just move up, have 9. So sometimes it's good to study the structures that you have, call them by name, so that when something is involving your vagina, you use the word vagina. If it's involving your vulva, use the word vulva, but leave it to the doctor to do an examination. Even a physical examination may let him ask you to scratch or go and touch where you think you're feeling discomfort or itching or pain or whatever. You may just send your hand and touch it and you notice that, okay, that's the prepuce. And he may understand what is happening there. That's the perineum, and he may understand that is the vaginal orifice or what. Please, sometimes we just use words that don't even make sense. This word last is pigeon, and the pigeon is so terrible that it just involves everything around here, both in front and behind. Even our mothers in the village refer to buttocks as last. So when you just say my last the itch, sometimes it misleads even the doctor, and some health personnel go as far as prescribing tablets for women to be inserted into vagina. Wrong. You are inserting into the vagina. Did you find out if truly the matter is inside vagina? It may be outside here on the vulva. Will the tablets inside vagina treat it? No. So it is a bit more challenging handling problems of the reproductive system. Now, let me continue with other signs. Dyspareunia. Dyspareunia is painful sexual intercourse. You feel pain inside your vagina during sex, either superficial or deep. It's a sign of a problem. Go and consult. Okay, blisters. Some people have blisters, some sores like wound or something around their genital organ. Once you notice it, go and consult, my dear brother. Loss of libido. Some of you even don't have appetite again for sex. You don't have sexual feelings again. The desire for sex, in fact, is lost. You just don't have feeling for sex again. Then go and consult. Something is wrong somewhere. Sexual weakness. If you so like a woman, even as a man or as a woman, like many people don't know that women also suffer from sexual weakness. And of course, low libido will make you just feel weak. And even when a man touches you, it means nothing. Whether a man is inside you, it means nothing. You don't have any feeling. No, the man will easily show well because the penis will not be able to erect well. And when a man cannot have good erection, the woman just looks at you like you are invalid. You are not man enough. So please, it's an indication that you have to go and consult. Then women must take note of menstrual disorders, painful menses, clotting menses, okay, absence of menses, a lot of problems involving menses, heavy menses that is too heavy, heavier than nothing. Go and consult in the hospital. My name is Dr. David Ayin. I shall be taking these topics one after the other in subsequent videos so that we go detail and even how to manage them. For now, the target was for you to determine signs of problems so you can go to hospital. The earlier, the better. Subscribe to this channel for more of this education. Like and share. Thank you.